Well, welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. My name is Tim Sheehy. I'm MMAC president, and I'm joined by Dr. John Raymond, president of the Medical College. Each day at 3:30, we bring you a 19-minute fact-filled update on the impact of COVID-19 on our health and our economy. This webcast is powered by Aurora WDC. We're also joined, as we are on Fridays, with our special guest, Mayor Tom Barrett. So, Dr. Raymond, we'll start with you with a recap of the week.
Thanks, Tim, and good afternoon, everyone. And as we do every Friday, we'll summarize weekly COVID-19 trends. The first slide summarizes various indicators of COVID-19, and I'll run through these quickly. Doubling times were stable to slightly improved at 16.1 days in Wisconsin and 19.9 days in Milwaukee. Daily growth rates over the last 7 days were stable at 2.9% in Wisconsin and in Milwaukee. There were 410 positive tests in Wisconsin today out of 6,059 with a 6.3% positive rate. Now the 6,059 tests administered today was a new daily high, and that's good. There were 148 new positive tests in Milwaukee with a 14% positive rate. Our COVID-19 diagnostic testing capacity is up slightly today to 13,382. And there are 356 COVID-19 patients hospitalized in Wisconsin. 125 of those are in intensive care unit beds. And of a total of 1,450 ICU beds in Wisconsin, 369 are immediately available. Our ICU and ventilator capacity are stable and they remain adequate. Personal protective equipment trends are stable both in Wisconsin and Milwaukee, with the most critical shortages of gowns and N95 masks. Next slide, please. This slide shows the trends for COVID-19 positive tests in Wisconsin on the left and Milwaukee County on the right. There seems to be a plateau, but not a clear downward trend of new cases in Wisconsin and in Milwaukee. Of course, we should be factoring in the increased availability of testing. Next slide, please. This slide shows trends for COVID-19 related deaths in Wisconsin and in Milwaukee County. And very fortunately, our deaths are much lower than in many other states. It appears that there might be a downward trend in Wisconsin and in Milwaukee, but there's significant variability caused by relatively low numbers. Next slide, please. This slide shows trends of daily tests administered in teal bars and total positive tests shown in the pink bars. Wisconsin is shown on the left and Milwaukee on the right. The black lines show the percentages of positive tests over the last 2 weeks, and there seems to be a clear downward trend of the percentage of positive tests in Wisconsin, but not in Milwaukee. Next slide, please. This slide compares the trajectory of growth of COVID-19 in Milwaukee, shown in pink, and the rest of the state, shown in teal. The vertical axis shows the total number of new cases over the last 7 days, and the horizontal axis shows total new cases. The data are shown in logarithmic scale to make it easier to detect downward trends. The plots show that Milwaukee has done a bit better than Wisconsin in slowing the trajectory, but that the gap is shrinking. And ideally, we'd like to see a sharp downward turn for both of these plots. As it is, these data suggest that we continue to have a relatively stable growth trajectory of COVID-19 cases, both in Wisconsin and in Milwaukee. Next slide, please. This graph plots the reproductive number, or R0, that we explained last Friday. Now, the reproductive number measures the contagiousness of a disease at any given point in time. If the reproductive number is 4, it means that one infected individual, on average, passes the infection on to 4 people. If the reproductive number is 1, then one infected individual spreads the infection from one person to another. Ideally, we'd like to see this reproductive number be less than 1, because then the pandemic would be fading away. So for this graph, I'll call your attention to the blue line, which shows the reproductive numbers for Wisconsin over time, and the tan line, which shows the reproductive numbers for Milwaukee over time. Starting from the left, you can see that we started with a high reproductive number back in early March, of about 3.5 in Wisconsin and 4.5 in Milwaukee. And that meant that the pandemic was spreading very rapidly. And by early April, the reproductive numbers had dropped to about 1 for both Milwaukee and Wisconsin. And I would say that the improvement is directly attributable to social distancing and for people staying at home. But we've stayed at the reproductive number of about 1 for the last 6 weeks without continuing improvement or significant worsening. Hence, we've reached an equilibrium or a steady state with COVID-19. Now, my fervent hope is that our reproductive number will not worsen over the next few weeks. And we all should monitor this metric closely, as well as COVID-19 hospitalizations in the coming weeks. And before I turn it back over to Tim, I do want to acknowledge Andrew Yaspin from the Medical College of Wisconsin for providing all these graphs for us. So Tim, I'll turn it back over to you.
Thank you, Dr. Raymond. Appreciate that summary. And we'll bring the mayor in. And for starters, Mayor, because I don't think everybody is appreciative of this, but in advance of the Supreme Court ruling, you actually worked with the 19 municipalities to get on the same page. So if that ruling came down, we would at least have a common set of footing to start. So can you talk to us about kind of where we are today with the municipalities in Milwaukee County and how you feel kind of moving forward?
Sure. Well, there's been a lot of change this week, Tim, and I think it all started, of course, with the Supreme Court decision. Before I even get to that, though, I just want to mention very, very briefly how pleased we were with the testing that we were doing, the community testing. The National Guard was here, and we have had literally thousands of tests, and we can talk a little bit about that later. But we could all see, I think, as all the people watching this today probably from their patios or their porches on this beautiful day, we could see that the Supreme Court was going to go in one of 3 ways. It was either going to uphold the governor's right to issue an order or the secretary's right to issue an order. It was going to strike down that order, but give the legislature and the governor time to negotiate something, which was probably what a lot of people thought was going to happen. Or it was simply going to end the order, which of course is what it did. That put a lot of people, I think, in a quandary as to what would happen next. And I think clearly there was a lot of confusion Wednesday night when the decision came down as to whether bars would reopen, whether they couldn't reopen. We knew that that was a possibility in the city of Milwaukee, and the suburbs knew that as well. And we're in a little different situation. The city of Milwaukee was in a different situation primarily because back on March 25th, we had issued our own local order, which frankly, I think a lot of people forgot about because it was followed hours later by the governor's order, which superseded it. So when the governor's order was struck down, that meant that they'll have the city order in place. And so we didn't have to act with the speed with which the suburbs had to act. We felt it was important to work together, but the 18 municipalities in Milwaukee County very quickly got together, and by approximately 11 o'clock that night, they all agreed, all the health officers, and this is an important distinction, all the health officers from those communities agreed that there should be an order in effect. Now, this order was very much in line with the Badger Bounce Back program in that it allowed retail businesses to be open. There would be limitations. It allowed to have salons and barbershops and beauty salons to open. It permitted retail. So it was starting to take the steps that I think all of us want to take to get life back to normal. And so that was issued Wednesday night. The city of Milwaukee, we issued one in line with that yesterday. And so it appeared as though at least through next week, we would have all 19 municipalities that would be operating on pretty much the same order, just with minor differences between what the city had done and what the 18 suburbs have done. Since then, I think several communities, I think Franklin, I think Cudahy have both now rescinded their orders. And I think, frankly, I think that's a reflection of a difference between the healthcare leadership and the political leadership in those communities as to the direction we should go. Of course, Waukesha has a different order. The city of Racine has a different order now. So what we're seeing now is the patchwork effect of having no continuity or no agreement among parts of the state. And I think the question going forward is, are cities, our counties going to start withdrawing more and more? what's going to happen, and I think this is obviously a concern to Dr. Raymond and the healthcare professionals, if we have this rush to the bars, for example, that we saw in pictures on television and in the newspapers. So I think it remains to be seen. My preference, quite honestly, is to follow the public health experts still. I think that it makes sense for us to have these criteria to reopen and do so in a gradual way. And part of the reason is I think that you still have a lot of people, including employees, including customers, who are scared. And so I think that's the dynamic. But I think it's safe to say that it is a very tumultuous time right now in terms of what's open and what's not open and what will happen in the next couple of weeks.
Yeah, it looks like, Brown County and Kenosha have both rescinded theirs. And as you just pointed out, Waukesha, Ozaukee, and Washington. And I think it's the inevitable pressure of, I can do this in one place, but I can't do it in the other. And so let me pivot a bit from this, Mayor, because I think that is going to continue to be the trend we're going to see. And have you talk about another piece which I think is very proactive, and that's getting industry experts along with your healthcare professionals to help companies operate. And I know you have one coming up for the hair salons and barbershops, and now you're going to talk about maybe restaurants and bars. And again, I think this is what we're going to need to do to operate in the new normal. Can you talk about what's coming up there?
Sure. And we've been in contact with experts from the healthcare industry, from the beauty salon, the barber industry. And we're working with Barbicide, which is a local company. For those of you who are familiar with, that's the blue water and the combs that are in the barbershops, and they may be in salons. I don't know if they're in salons, but they're certainly in the barbershops. That company's located here, and they have an interest in making sure salons and barbershops that open do so in a safe manner. So their interest is not as much in the timing, just as in the safe reopening. And so we've been working with them, and we put together a webinar very much along the lines of what we have right here for tomorrow morning at 11 o'clock. And we can get that information, Tim, for you to send out if you want to. So the barbershops and salons and beauty parlors can come and hear from the nurse, who is the expert on this in terms of a safe reopening. We're also going to have
You're breaking up a little bit, Mayor.
Our health department, and to the extent that viewers are from the area, it's very much in line with orders have in effect right now.
Okay, we got some technical difficulties. Let's bring Dr. Raymond back in, Chris, and go to questions here.
We view this as an
Yeah, let's start with Dr. Raymond while the mayor get his technical difficulties sorted out. Do you have any statistics on asymptomatic tests?
Help businesses reopen in a safe manner. There's still a lot of uncertainty for a number of businesses. As we know, there's a lot of uncertainty for consumers as well. We intend as early as possible next week doing similar restaurants and for so that we can restaurants and bars as well.
Go ahead, Chris.
Yeah, Dr. Raymond, we had a question about whether there are any statistics on asymptomatic tests, whether we know the number of people who've tested positive but don't have any symptoms.
Yeah, that's a great question. I think if you look at all the literature and you pull out the information that's reliable, it could be between 20 and 50% of patients who are asymptomatic when they're screened they could be pre-symptomatic and eventually develop some symptoms. And that's one of the flaws of taking one snapshot in time. But it could be anywhere from 1/5 to 1/2 of the people that are screened that may have asymptomatic presentation.
Another question about something President Trump announced today is a effort to get a vaccine up and running by the end of the year and possibly dispensed by the Army. Is that a realistic program?
You're talking about Operation Warp Speed for the
yeah.
vaccine? Yeah. Whether it's realistic to have 300 million doses by January or not, I don't know, but I think the government is going to be paying companies that have promising vaccines to start producing now before the vaccine has even gone through the 3 phases of clinical trials. If we want to have a vaccine and people are willing to put some money into it, I think that's a good approach. My understanding is that they've identified 14 promising vaccines and that they're culling those to see which ones to invest in.
Tim and Dr. Raymond, we also had a question about how manufacturers can keep their employees safe as they ramp back up, and that may be a chance to see something we may roll out next week, right?
Yes, and I think, again, due to the leadership of the Medical College of Wisconsin, we're going to be partnering on a toolkit that I think will be of great help to employers in a variety of industries as they look to find best practices as they bring their employees back and continue to work. And as we just heard in the discussion with the mayor, I think we're going to see more and more communities that open up their economy. And now we're going to move from recovery into the next normal more quickly. And we're going to get a lot of questions, and we want to provide a lot of companies with information about how to safely operate. Dr. Raymond, you want to talk a little bit about that?
Yeah, I think in particular because of the disorganized way that we've had to try to restart our economy here, that this is a really important issue. And I think most employers want to keep their employees and their customers safe, and they're looking for guidance. So MMAC has been a real leader in that regard. WEDC also has some good guidelines, and at least for now, I would recommend that people check those out. Mayor Barrett is collaborating with various sectors of the economy in Milwaukee here. So there should be some good information.
Tim, we also had a question about whether there's a single source people can go to see the status of all the current local orders in our region. That'll be in our email to membership later today, and I'm going to drop that information in the chat window right now. But I will say it keeps changing and has even changed since we put this together earlier today.
Yeah, so we'll try our best to do that, but this is an evolving situation. It seems almost by the hour as different communities are making decisions. And again, I think this is just an inevitable tide, if you will, of commerce as companies are open in close proximity to one another. It's going to be more and more difficult. And so I think we should just prepare ourselves to operate again in a safe manner going forward, because businesses are going to start to reopen all across the region.
I understand the mayor may still be on with audio. Is that true? If not, we can go to another question for Dr. Raymond. We were wondering whether there's a good source for data.
I'm here. If you hear me, I don't know if you can hear.
Great, welcome back. The new reality of webinars, right? Mayor Barrett, how long do you expect the city's stay-at-home order to stay in effect? Do you have a forecast on when we might see that change?
My preference is that we continue to do sort of the gradual reintroduction. I've listened very carefully to Dr. Raymond and other health experts about doing this in essence, a coordinated way with the health experts. So I still use the analogy to the dial, that we want to dial this up so that I think in the next couple of weeks you'll see more ability to have larger gatherings. You'll see more retail space that'll be used. That's what our intent is right now. Of course, a lot of this is dependent on our health experts and listening to the experts. But as Tim said, no one can deny that there is now clearly a political dynamic at play here as well.
Another question that may be good for Dr. Raymond and the mayor, is there a good source for data on how the pandemic is affecting underrepresented communities beyond just knowing that it has hit them harder than some other communities?
There are lots of good sources. I think our local papers have done a really good job of covering the health disparity impact. Mayor Barrett has highlighted that repeatedly. And even the Washington Post and New York Times have really put out some good work on that. I think it's important that all of us recognize that when we're trying to protect vulnerable people during this restart, it isn't just individuals with comorbidities or in congregate living and working situations. It's people of color that are coming from under-resourced neighborhoods that we really have to think about and protect.
In addition to that, the Milwaukee County has a great web page, and you can break out number of cases by race. You can break out the number of fatalities by race, by age, by gender. There's a map that tells you where the cases occurred. You could spend 15, 20 minutes and you'd get a lot of information on that web page. It's very, very impressive.
Very good. Tim, maybe one last question. From talking to our members, are there unique challenges that manufacturers face as they kind of spool up production here?
There are unique challenges for every industry, every business, and manufacturers, again, it's where they have a very organized production line and flow, and it's almost like a well-articulated dance. And now you have to do that at greater distance, watch for pinch points, make sure that people have protective equipment. And so really every business and every industry is going to have to go through a set of protocols to make sure, again, that their employees are confident when they come back to work. And so again, this will be a work in progress, and we hope to have, in addition to other resources out there, a good toolkit for employers to access.
Great. Thank you to all three of you, and thanks to everybody who asked a question today. Dr.
Raymond, again, thank you. Mayor, sorry for the loss of the partial video here, but appreciate you joining us. Everybody have a safe and healthy weekend. And next week, we'll be back on Monday, Wednesday, and Thursday with Dr. Raymond. So again, thank you and have a safe and healthy weekend.
Thanks, Tim. Thanks, Mayor Barrett.
Very much. Thank you all.